Well, my name is Paul Sunderland. I've been an addiction psychotherapist for about 35 years. That might seem strange. I may not look old enough for that to be the case, but it is. And I came into this work actually having had an experience with addiction as a 23-year-old, going to rehabilitation then, which was a very new thing in this country. I was a heroin addict and a bit of a lost boy. And I came into recovery. And I guess I had an experience that I wanted to pass on. You don't go and train straight away. I did a whole lot of other things. Actually, I worked in the music industry, which felt slightly like being on the consuming end of the addictions field at the time in the early 1980s. But I trained as an addictions counsellor. I then trained at the Department of Psychiatry, actually, at Guy's and St Thomas's Hospital as a psychotherapist, and became an addiction psychotherapist, and then worked in a hospital setting at quite a well-known addiction hospital called Cloud's House in Wiltshire, which actually we use as Pharmacist Support. It's a 30-bed addiction hospital. Provides a marvelous service. What I really like about it is that actually it also is, it treats a social microcosm of patients, so it's not an entirely private hospital. In 1999, I was headhunted actually to go and set up a clinic in the West Indies that was funded by Eric Clapton, in actual fact. And we moved with my family to the West Indies. We set up a clinic, and then I came back and set up a practice of my own doing addiction psychotherapy. And that's what I've been doing ever since. I feel really blessed to do something that I enjoy, that I believe in, because I know that if somebody wants to get well, it is possible now to recover from addiction. So what I like most about my work is there's an opportunity to help people to recover. And the marvelous thing about addiction is that if people want to recover, they can. It is not easy. After heart disease and cancer, addiction kills more people than any other illness in this country. If you're under 25, it's the biggest cause of death. And of course, we know it's very clever. It can kill in so many different ways. But if people want to get well, it is possible. And it's a real privilege to be part of that journey for people, helping people to help themselves. What I love about working for the charity, other than the people I meet who work for the charity, is that actually how progressive it is, that you are able to see something which I think is such a struggle, particularly for pharmacists who work so much on their own, who have access to mood-altering chemicals, of course, in their work, but also will have an enormous stress, and increasing stress as I see it, in terms of changing job and workloads and responsibilities. Often who, like most healthcare professionals, have a feeling that asking for help is really difficult, often have a sense of, I know this stuff, I'm a clinician, I shouldn't be struggling like this. And what we know about addiction is that it's a bit like mushrooms. It grows in the dark. And actually, what I love about Pharmacist Support is the recognition that actually, pharmacists can suffer, healthcare professionals can suffer and are deserving of help, both for themselves, but also, of course, it enriches the profession. The thing about addiction is, and indeed the addiction field has been changing fast. It used to be that addiction was thought about in terms of just alcoholism. And what we now know is that actually addiction isn't so much about a substance, it's about the need to change the way that somebody feels. So we tend to talk actually about alcohol and drug addiction, but of course alcohol is a drug. And often we talk about what we call chemical dependence. So a dependence on a mood-altering chemical to change and manage mood. So we have a definition. There are lots of different definitions of addiction, but one of the ones we work with is that we see it as an all-consuming relationship with a substance, but also actually with a behavior, and I'll come on to that is motivated by a conscious or unconscious desire to change the way that one feels, that results in a range of harmful consequences. And that's the important bit, the harmful consequences, because in a sense, addiction is repeated use despite knowledge that it's not in my best interests. What we also know about severe dependency on drugs and alcohol is that actually, once people have lost control of their use of drugs and including alcohol, they are unable to come back to a position where they can control their use. There is a tipping point in which actually abstinence is necessary. And so it becomes a disease a bit like diabetes, where you have it, but it can be managed well as long as you abstain from certain things. Now, there's all sorts of psychological processes to help you stop. Now, the other thing about addiction is it is both a primary disease, but it's also a symptom of a distress. People don't get out of bed the wrong side. It doesn't suddenly happen to them. Actually, it builds up over a period of time. But you can't deal with anything, and we call it a primary disease, until you actually help people manage the loss of control over mood-altering chemicals. Now, the other thing that's really important is that, I'm emphasizing it being a disease. The World Health Organization calls it a disease. The International Classification of Diseases that the medical profession use, it is a disease. This isn't about people that are weak. It's not about people who are bad. People who suffer from addiction have as much power over their behavior as somebody who suffers from COVID or the measles. And it's really important for us to acknowledge that we are talking about disease, particularly as it has such a stigma and such a shame, because people who suffer from addiction, they are hijacked by their behavior. And they end up doing all sorts of things that they never thought that they would do. So it's very easy for them to think, gosh, I'm bad or I am weak. So it's really important that we help destigmatize that. What we've also discovered about addiction is it is a disease that migrates. So when people stop using mood-altering chemicals, very often their addiction shows up in other areas. And of course, that addiction can show up just primarily in other areas. Very typically, we think about the eating disorders: compulsive overeating, compulsive undereating, which is the anorexias, the bulimias, the orthorexias, which is the unhealthy obsession with eating in the right way at the right time, eating the right things. These are also all ways of managing distress through a process, which is why we call them process addictions. We talk about the sex addictions. We talk about the financial addictions, things like compulsive spending, for example, and also the financial addictions have an anorexia, which is what is commonly called now under-earning, which is a restricting one's. So despite one's ability to maybe earn a certain wage, restricting the need for career or money or being in the world. Very often people are self-employed, they don't invoice, don't charge enough, don't follow up, things like that. So addiction shows up in so many different, in so many different places. I think the issue of addiction is particularly difficult for pharmacists and other healthcare professionals. I think particularly because they are concerned with healthcare and somehow feel that, this shouldn't happen to me, or I'm not good enough if I'm struggling with this. But I think I would want to say, look, I think it's exactly the same. If you were an oncologist and you got cancer, would you feel ashamed? I think, it's really important to know that we're talking about disease, but it's also really important to know that actually addiction will impair fitness to practice, and you do need to get help in order to both deliver, but for yourself and for the rest of your life. And actually, in getting help, it will help destigmatize addiction. But I do notice certain things, and I think particularly for pharmacists, which I think is a lot harder than working certainly for doctors, for example, in practices, is that very often the pharmacists might be locum pharmacists and work alone, or might be employed full-time, but actually be the only pharmacist, or certainly maybe the only pharmacist on duty. And I think there's a sense of responsibility, a sense of sort of management as well, that can make asking for help and being vulnerable very difficult. So I think very often the pharmacist is not somebody who will come to work and have somebody who will say, so how are you? How was your weekend? They may very often be the sort of people that come to work and ask that question of somebody else. So they have developed an avoidance, if you like, of talking about how I feel and perhaps focusing on the other. And of course, that's also the job. You're not going to sit with a patient in a pharmacy and when they've told you how you are, say, can I tell you how I am? It doesn't work like that. So, I think it's very difficult. I think it's lonely. I think it's a fast changing profession. I think it appears to me that there's, like many things, there's a lot more admin, there's a lot of ongoing learning, but not a lot of opportunity for support. And so I would really want, and it's one of the things that excites me about Pharmacist Support, is there's an acknowledgement of like, you need support. It's okay to be vulnerable. And what's more, if you can't be vulnerable and you don't make it okay, you could really suffer. Well, I think the good news about addictions and dependencies is that public attitudes are changing. There was a time that nobody would talk about it. The danger is now it's pretty hard to find a film star or a rock star who doesn't stop talking about it. So there is a sense that this is a thing, and this is a thing that's out there. I think employers are changing attitudes, of course, towards all of this, and there's a big awareness of mental health. And of course, addiction is a mental health disorder. Thinking becomes disordered. Continued use, despite knowledge that there are harmful consequences, is a health issue. And I think employers in general are understanding that. How much they know about how to support that, I think that's growing, in truth. But I understand that people will be quite anxious about talking to employers about their difficulties for fear of how it will be understood. Okay. Well, the advice that I would give to somebody who suffers from alcohol or other drug problems, or indeed any other addictions, whether it's spending, sexual behavior, eating disorders, is to understand that nothing can change unless it's acknowledged. Addiction grows in the dark. There's a real stigma, but the real shame would be in not doing something about it because it has such an impact on every area of functioning. And that's what we've seen. And of course, for a pharmacist, it has all sorts of fitness to practice issues. It has legal issues. It has family relational issues. It has health issues, physical and mental. So it's a very key concept. You can only change what you acknowledge. There's also that you're not going to be able to do something about this alone. If you meet the criteria for dependency, which is a cluster of symptoms that include preoccupation, so you might wake up thinking about it, go to bed thinking about it, do your job thinking about your addiction. If you have a sense of tolerance where you need more alcohol to get the same effect, for example, more drugs to get the same effect. If you experience a withdrawal syndrome, if you experience a loss of control, that once I start, I don't know when I'm going to stop. If you've had unsuccessful attempts to control, that you've said, all right, I'm not going to drink spirits, I'll only drink beers and wines, or I'm only going to drink at the weekends, or I'm going to try and cut down, and that's been unsuccessful. Chances are, you are experiencing a powerlessness, not a weakness, not a badness, but a powerlessness. And you're going to need to talk to someone about that. And because you will not be able to do something about it on your own. Well, there's a range of options available to people who have difficulties with alcohol and drugs. And it depends very much on severity. This isn't a binary thing, like actually you're either severe, you're either alcoholic or you're not. There's a whole range from people who might be teetotal for whatever reason to people that are absolutely the other end of the spectrum, are completely out of control. But at some point on that spectrum, there is a loss of control and this symptom of continued use, despite knowledge that it is not in best interests. Now, once that starts to happen, one of the reasons I'm involved with Pharmacist Support, I believe, is to offer some sort of assessment to assess, with the client, what is going on, what's been going on, what do we need to do to come up with a plan of recovery together. Now, sometimes that might involve some community support in terms of perhaps some counselling. It might involve some community group support, and there's an awful lot of self-help free at the point of delivery groups available For example, some of the most successful interventions are things like Alcoholics Anonymous or Narcotics Anonymous. Again, self-help groups. For people with a severe dependency that actually requires a detox, who need a medically managed treatment, actually there are different conversations, and we'll probably need to have a detoxification in a medical setting, followed by a lot of psychoeducation in the skills necessary to stay stopped. Because the important thing about recovery from addiction is it's not about stopping, it's about staying stopped. That's the difficulty. My top tips for addressing dependency and addiction. The first thing is to understand that we can only change the things that we acknowledge. Nothing gets well, and better secretly. That doesn't mean you need to post it on the internet and tell everybody, look, you've got a big problem, but it does mean that you need to tell somebody. And ideally, you need to also tell someone that might be able to, who can be an enlightened witness, who can hear what you're saying, but actually be enlightened. So, this addiction is a disease that flourishes in the dark. Nothing, you can only change what you acknowledge. I think the other thing I'd want to say is that much is possible, talk to other people who suffer from the same illness. Not everybody is going to understand addiction. For many people suffering from addiction, there's a real sense of disconnection and not belonging. There's an awful lot that comes from talking to someone else and realizing that your suffering actually has a universality. I'm not the only one. For colleagues, friends, relatives, or people who suffer from addiction, it's really important for them to know that actually they can also suffer. They can unwittingly collude in an atmosphere of secrecy, sometimes covering up. We meet a lot of partners who will make excuses for somebody who suffers from addiction. So actually, there's a real need for some psychoeducation, that actually covering up is actually enabling something to flourish. Now, having said that, confronting something is really difficult, but there is a whole syndrome for people that are around, and particularly for people that are attracted to people who suffer from addiction. I would really want to encourage anybody who had a concern to treat their concern seriously, because nearly everybody says, I think I might be making a bit too much of this. I think everyone doubts their reality. They almost don't want to, and are very torn about the idea that if I confront this is right. This is the right thing to do, but what implication will it have for the person who suffers? So I would really encourage them to talk to somebody who understands this stuff. The field of addiction treatment is changing all the time. It's changing all the time. There was a point at which actually very often addiction was treated with other drugs. And people found that actually, if you do that, you can often create another dependency. We had the same with people who are addicted to opiates and opioids, being actually prescribed a different sort of opiate or opioid. People addicted to alcohol were being prescribed benzodiazepines, who then develop a dependency. So we realized that, pharmacological approaches may have their place, and there's certainly a place for, perhaps anti-anxiety medications, antidepressants, for example. But actually, what we've really discovered about addiction treatment is that actually it's an inside job. Addicts are people who have tried to change the way that they feel from the outside in. And actually, what is most effective is helping people regulate themselves from the inside out. Now, very often, that involves not only being honest with themselves that they have a difficulty, and of course there's lots of vulnerability for a healthcare professional in that situation, but it also involves being able to talk to some people, a sense of co-regulation. Nobody's going to rescue me, but I don't have to do this on my own. So treatment has focused a lot on group intervention processes, and hence the success, of course, of things like Alcoholics Anonymous. What we know now, with the advent of mindfulness, particularly, is that actually there are some very good techniques that people can have for changing how they feel inside, and they actually have to do with breathing. And what we know is that people with high degrees of shame and anxiety, people who keep themselves to themselves, tend to be shallow breathers, and that actually being able to train yourself out of shallow breathing, because shallow breathing is a defense, if you like. It's an attempt to stay hypervigilant because the world isn't safe. Actually, teaching people to breathe properly in terms of the out breath, which is something that's been known for tens of thousands of years, actually. I mean, well, maybe thousands of years, for a long time. It's a really good way. It's why people, when they go, it's why you might chant, it's why you might sing a hymn. You know, the hymns that people really like are the ones that have the long out breaths, chanting. You know, it's been there. It's sort of been known that actually the long out breath calms the parasympathetic nervous system. We also know actually that this is what's behind why smoking is so addictive. It's not the nicotine. It's not the carbon monoxide that might slightly sedate you. It's the fact that most smokers are anxious people and that they tend to be shallow breathers. And the only time that they take a long out breath is when they're exhaling. So one of the things that we're doing when we're trying to teach people and help people give up smoking, for example, is actually teaching people to regulate their parasympathetic nervous system through an out breath that doesn't involve breathing out smoke. One of the things I love about working and being associated with Pharmacist Support is actually there is a range of interventions for pharmacists who are struggling. I think most excitingly actually is the peer support group, because I think asking for help is such a difficult thing. So actually ringing the helpline and maybe being referred to somebody like myself might feel like too big a step. It's certainly a step that many people can take, and I can assess together where people are at, and we can come up with a quite creative recovery plans. There's certainly help is available. You know, that's for sure. But people understandably have all sorts of fears about confidentiality. You know, will it be on my medical notes? The answer is, of course, absolutely not. You know, this is and can remain anonymous, actually. But I think the peer support group is really innovative, because the brilliant thing about Pharmacist Support is that they recognize that this is a thing. And it's a thing everywhere, by the way, addiction. But this is a thing, and people who are ill are deserving of help, both for themselves, but also for the work that they do, and also for their families and the communities. And we've seen people really turn their lives around and become really families recovering, people bringing all sorts of things into the community, carrying a message that destigmatizes addiction too at times, you know, and being helpful. But also, of course, being able to do what they're trained to do, which is to be an effective pharmacist. But the peer support group, I think, is really exciting, because I think it's an opportunity for a pharmacist who thinks they may have a difficulty with addiction to talk to a pharmacist who knows that they had a difficulty with addiction and has recovered, and actually really wants to openly, you know, give something back, and to have a non-judgmental conversation about, you know, what it means to struggle with addiction. If you would like a consultation with an addictions specialist, you know, through the Pharmacist Support helpline, it's certainly something that I'd be really happy to help with. It's something that Pharmacist Support contract to an addiction specialist, because this is not an uncommon occurrence. You would be referred to me. I think one of the first things that would happen, you would have talked to a member of Pharmacist Support. They would have passed on some contact details, whichever ones that you would want to give to me to be contacted. You don't have to use your own name. We would arrange to have a telephone conversation in the first instance, where within the boundaries of complete confidentiality, nobody needs to know that you've made the call. There won't be any record of it other than a few scrawled notes that I might have following that first conversation. But what we would seek to do is to get a history, really, from you about, you know, what's going on now, what's been going on. Chances are that you've been suffering for a long period of time. This isn't something that happened last Friday, and it's not something that's going to be fixed by Friday. We will have a chance to look at the history of all of this, to see what is happening, and to come up with a plan together to address your difficulties. And that plan could involve a range of things. It might be a referral to local services, it might be a referral to services that aren't local if that's an issue for you. It might be counselling, it might involve some detoxification, it might be referral to self-help support. But we would do that together. It would be a co-creation, based on the information that you give me in confidence. So if you are a pharmacist student, trainee pharmacist, or pharmacist in Great Britain, please feel free to get in touch with Pharmacist Support. It would be such a shame to not have the opportunity of recovery. What you're struggling with isn't about weakness or badness. We're seeing addiction and dependency as a disease. It will only get worse if it's not addressed. We can provide a confidential space to help assess your difficulties with you and to come up with some advice.